All right, so looking at the specific products we got showing here, right? Obviously, there are differences in the dosing and the frequency. So, our immediate release, which is really looking at 3 to 5 hours of coverage, that's our Ritalin, methylene, Focalin products, right? These are usually done twice a day, not often more than that. Sometimes someone might take a longer acting product and then have an afternoon dose of a shorter acting product as well. That's sometimes done, again, titrating to the specific needs of the individual. All I really want, if you are like one of the PA students that's watching this, know which ones are the immediate release, right? Don't worry about the dosing or the specifics. Know that the Ritalin, methylene, Focalin, those are our immediate release, short acting stimulants. Then we got this beautiful other list here, right? And these are going to differentiate by duration. So anywhere from 8 hours to 12 hours for these products. Their release formulations are going to be different, and their like drug product is a little bit different because we've got dexmethylphenidate, which is going to be a lower dose because we're taking kind of the more active part of the molecule mixture and using that. Now, one thing I do want to note is this product here, Jornay. So Jornay PM. It is a product that is unique because it has a highly delayed peak. So its peak delays by 10 hours or so, which essentially means that it can be taken, needs to be taken the night before. And this is nice if one of the challenges that, say, a kiddo or an individual has is that they got rough mornings, right? They have trouble getting going, keeping organized, getting their stuff together, and they need that coverage first thing in the morning. Jornay may be a really good choice for them. The other piece that's interesting is the Daytrana patch. So the Daytrana methylphenidate patch goes 10 to 30 milligrams, and it is applied 2 hours before onset of action, essentially. It should be alternated on different hips. We do see some skin discoloration. I think the newer formulations haven't had as much of that, and it supposedly can stay on during bathing and swimming. I've not seen a ton of success with that, though, but it can be helpful if someone is struggling with swallowing medication. It's also potentially helpful, again, because of that customizability of when to take it off. So you can wear it as long as 9 hours, but you can take it off sooner if needed. Now, looking at the amphetamine formulation, so we've got our short to intermediate. We have an intermediate product, long, and our long-acting and a transdermal. So our short-acting products are Evakeo, Adderall, Zenzetti, Procentra. Okay, so those are, again, going to be that like 3 to 5 hour type product. Then we've got a bit more variety because these originally are in like a mixed salt formulation. So amphetamine, dextroamphetamine, these amphetamine salts. But there are some that are more specific kind of components of the amphetamine salts. All right. Then we have our lisdexamphetamine products. So Arinta, which is a solution of lisdexamphetamine, and then our Vyvanse products, which is that prodrug. So lisdexamphetamine is a prodrug, once again, that gets broken down by the liver into an active form. So it really has a much kind of smoother and slightly more delayed onset. So you're looking at more like 1.5 to 2 hours versus usually about an hour-ish for our other extended release products. Our transdermal product for our amphetamine side is Zelstra or dextroamphetamine. Same kind of idea than with the Daytrana patch. Okay, so we're going to talk about non-stimulants. I'm just going to move right into the non-stimulants here. So our non-stimulant products are different by and large because unlike stimulants where they're specifically designed to be taken and then they clear out by the end of the day, so they start to work right away. You can take days off of taking them. These types of products are generally recommended to be taken every single day because they are products that don't have that quick on and offset. So they're going to be present in the system pretty much, at a steady state throughout the duration of the day. So atomoxetine is a norepinephrine reuptake inhibitor. So it just increases the availability of norepinephrine in the synaptic space to, once again, help with that regulation in the prefrontal cortex. Boxed warning. So one thing to take into consideration, like other products that have risk of suicidal ideation, this one is elevated to the boxed warning level. So we do want to make sure that we're watching for that and educating. If you feel a lot worse, if you feel any new symptoms of, well, any symptoms in a lot of cases, but new symptoms of wishing you were dead or self-harm, etc. Contraindications because of its effects on things like norepinephrine. It can worsen cardiovascular illness if someone uses an MAOI. Now, that's similar to other products as well. So anytime you have someone that's on a monoamine oxidase inhibitor, call your local pharmacist, right? Check in, make sure that it's okay. If someone has poorly controlled glaucoma, this can worsen it. And pheochromocytoma, which is really rare, but that's an adrenaline secreting tumor, because of its boost in norepinephrine, can be problematic to use with it. There are pharmacokinetic and pharmacogenomic considerations here beyond the scope of this particular lecture. But again, if there are concerns, talk to your team and check in on what those concerns look like with other specific conditions and medications. Most common things that we see are sleepiness, but sometimes people can get stimulated on it too. So with a lot of those types of products, every brain's a little bit different. Upset stomach, decreased appetite, headaches, very kind of standard stuff, and things that we see with antidepressants as well, like sexual dysfunction. So things like anorgasmia, low libido, etc. There is a risk of hepatotoxicity, so it can be damaging to the liver. Usually we'll monitor for symptoms and just check liver function tests periodically. Other warnings, it can sometimes worsen aggressive behavior. It can trigger mania. There are cases of low blood pressure, so that can result in orthostasis, or that like sudden drop in blood pressure and fainting. It can cause allergic reactions. We do see priapism with it. Mostly pretty darn well tolerated, though. We give this list, but it's pretty common that people don't experience much side effects, really most of these like headache, dry mouth kind of side effects. But it does tend to take several weeks to really reach its full effect. And we have a similar product, viloxazine or Quellbri. This is a norepinephrine reuptake inhibitor. Has very similar stuff. Okay, there are less specific contraindications. They're more drug interaction related contraindications here. Very similar adverse effects. That's sleepiness, decreased appetite, irritability, etc. Warnings, same kind of idea, right? So blood pressure, heart rate increase, changes in psychosis or mania that we can see with that increase in norepinephrine availability, but pretty rare. Now moving into our other non-stimulants. So these are kind of interesting. So our clonidine and guanfacine. So we've got clonidine ER, which has two brand names, Capve and Oneida. And these are actually alpha-2 adrenergic agonists. So how the heck does that work? Essentially, we think it stimulates our inhibitory presynaptic autoreceptors in the central nervous system. What the heck does that even mean? It's kind of like increasing the activity, if you will, because of its like fix on these autoreceptors. Those autoreceptors kind of modulate their own activity, right? So when we see alpha-2 is usually innervated by things like norepinephrine. Okay. So I almost just described people like it's kind of increasing the flow. You know, it's an antihypertensive, but it sort of increases the flow up in there. Because it's an antihypertensive, we do sometimes see in people who are normotensive, people who don't have high blood pressure, it can lower blood pressure, which can be symptomatic. So things like sedation and dizziness, because it does kind of chill things out, calm things down. Other things that we'll see if someone's taking it pretty consistently and usually at higher doses. If it's a teeny tiny dose, it's not as big of a risk. But if someone is having consistent exposure to clonidine and stops suddenly, you can actually see rebound hypertension. So you do want to be careful with that. If they are taking really a dose of 0.1, they should taper down and monitor their blood pressure. Other things to think about: if an individual is experiencing vivid dreams, it can be caused by this. So it really assess for if it's troublesome or problematic for the individual. I'm trying to think what else I want to say about this one. Really, it takes 2 to 4 weeks really to work. So similar to other non-stimulant products, they take longer to work. Not as beneficial in adult ADHD. I do sometimes like to add these on if someone is doing well otherwise, but having trouble sleeping, maybe a little bit of residual symptoms. This can kind of help balance out some of those adverse effects. Next, we have guanfacine or Intinib. So kind of similar. So this works on our alpha-2 receptors as well. So if you look, this is a central alpha. This is a postsynaptic alpha, but still very similar mechanism of action. It does tend to work close to as well as some of our other products, right? So it has similar efficacy to our Strattera or atomoxetine. I got a Teams meeting, of course, during this. I've been recording too long. I'm not going to stop. But it is also a product because of its alpha effects it's going to lower blood pressure. Okay. It doesn't tend to be as sedating. So again, if I'm trying to help someone kind of kill 2 birds with 1 stone by helping with their ADHD symptoms and also helping them sleep, I'm going to pick a clonidine over a guanfacine. But if someone's dealing with excess sedation from a clonidine, then the guanfacine might be a better choice. It's just a little bit better tolerated from that perspective. So adverse effects, low blood pressure, low heart rate, and stopping suddenly can cause elevations in blood pressure. Individuals should generally avoid taking it with a high-fat food because we can see a change in the absorption of the product with high-fat food. It takes a few weeks to work, as I mentioned before. So our general clinical things to think about. Guanfacine is more selective. It tends to be better tolerated, but not as good to help you if insomnia is an issue. Although not FDA approved for treatment of ADHD, some individuals may utilize a clonidine patch instead of the clonidine oral. And you can transition someone to that if they have a nice stable dose. Not as helpful in adults, not as much data for adults. Does that mean we won't try medications like clonidine and guanfacine? No, but just realize that you're probably not going to get as robust a response. Remember, we're looking at 70 to 80% of people with ADHD will respond to a stimulant, particularly if we're starting it when they are a pediatric. It is often used in adjunct in our pediatrics, and it can help do things like reduce disruptive behavior. It can help manage insomnia. It can help reduce aggression.